Hello, this is Lynn Goldman, and I'm here to talk about this flu season in 2019 and how we can protect our own health and the health of members of our family. So it's important to recognize what is flu and the fact that every illness that we have in winter is not flu. In fact, most of them are common colds. But flu is an acute illness, meaning that it comes on suddenly and it doesn't last very long, and it results from an infection by an influenza virus. Flu, as you all know, is highly infectious, spreads very rapidly from one person to the next, and there are different strains of flu, some of which cause illnesses that are much more severe than others. It's important to recognize the symptoms of flu because that is one of the primary ways we protect people, is by recognizing that we may have the flu. And flu is generally of sudden onset. You get a fever, headache, aching muscles, severe weakness, as well as respiratory symptoms like cough, sore throat, and difficulty breathing. And so it's a little bit more than just like a cold-like illness, in that you do have usually that headache and those muscle pains as well as a fever. Incubation period, how long does it take to develop the flu after you're exposed to it? The range is anywhere between 1 and 4 days. For most flu viruses, between 2 and 3 days. That unfortunately does mean that you can be infected and then nonetheless be spreading the flu without being sick. So influenza is spreading from one person to the next, and we need to be in pretty close proximity to another person in order to get the virus. Unfortunately, though, it spreads through coughing and sneezing. There are droplets that are broadcast into the air when we cough or sneeze, and actually there are quite a number of them, and they go quite a long distance in a space. And when you breathe in those droplets, you can become infected by the flu virus. They also can be spread through directly touching an infected person, or unfortunately a surface that's contaminated with the virus, such as surfaces become contaminated when they're sneezing or coughing by somebody with the flu. Flu is of ancient origin. We've known about it for a long time. 412 BC, it was mentioned by Hippocrates, and the first flu pandemic description that we know of was in 1580. And since that time, we've had a number of them. They cycle with unpredictable numbers of years and intervals between them. Unfortunately, we have no way of really predicting when we're going to have a major flu outbreak. There are 3 types of flu that are really important for people. The type A, which can also not only be hosted by people, but also birds, pigs, and horses. Type B, which is a human disease, and type C. And we classify the influenza virus on the basis of small protein molecules that are on the surface of the virus. And without going into technical detail about these molecules, but some of them are called H markers. H stands for hemagglutinin, and there are 15 of those that we're aware of in nature, and others are called N markers, or neuraminidase markers. But these markers aren't just to help us to identify which bug we have. They also have, they enhance the ability of the virus to either attach to people or to replicate. And so they can also be signals of how bad that flu is going to be on the basis of it being able to infect a person or to replicate itself. So when we talk about flu, we talk about these 2 concepts of epidemics and pandemics. Epidemics are serious outbreaks that occur in a community or a population, and actually every winter we have a flu epidemic. But pandemics are much more major outbreaks that spread around the world, affect hundreds of thousands of people across many countries, and are therefore far more serious. Seasonal flu, then, is kind of an annual and predictable epidemic. And last year we had a particularly interesting flu year because it was the longest flu season ever, 21 weeks in length. That was because we actually had a double hitter. We had 2 epidemics, one by a virus called an H1N1, and then a second by a virus called an H3N3. that most of us perceived as just a very long epidemic of flu, but it had consequences in terms of how we could get vaccines and how we could protect ourselves. Now, for this coming year, the outlook is, it's still a little hazy, but this is what the experts think. They think most likely our epidemic will occur between October and the beginning of April, which is the normal flu season, not a long one like 2018, and most likely that we'll see a peak in February. And what we've been preparing for under the guidance of the World Health Organization, or WHO, and the CDC is 4 flu viruses: the H1N1, the H5N2, and 2 influenza B viruses. When you package these 4 viruses into one vaccine, we call that vaccine tetravalent. So if you hear that term tetravalent, that's what that means, 4 viruses. So getting the flu vaccine, hopefully by the end of November, is the single most important step that you can take. And unfortunately, you have to do that every single year. The components that are in the vaccine for 2018 won't protect you from the flu that will be circulating in 2019. And because the flus shift every year, and also because the immunity is actually not very long lasting, you need to get the flu vaccine annually. But the good news is that the vaccine that's tetravalent, that covers all 4 of the circulating viruses in 2019, is available in all of its forms. And so we have a form called Flu Mist, which is a nasal spray, which is available for people between the ages of 2 and 49, not for children under the ages of 2, and not for older people, people 50 and older, for whom it hasn't been tested. But still, most people theoretically could get the nasal spray, and that is a very convenient way to receive the vaccine. Injectable vaccines that are widely available, including versions that are egg-free, and if you suspect or know that you have an egg allergy, you need to be sure to let your vaccine provider know that so they can give you the egg-free version. And then special forms that are either higher dose or contain something called an adjuvant that boosts the immunity are recommended for people who are over the age of 65. And that's because as we age, our immune systems don't respond as vigorously to a vaccine, and we want to especially make sure that the older population is protected. The bad news is that not all vaccine forms are yet available in sufficient quantities. I'm speaking to you now in mid-October. There's a lot of effort to produce those. I had a personal experience this week going out to get my vaccine, which I was able to get. I've got a little Band-Aid on my shoulder here. But the first 2 places that I went for my vaccine, they had run out of the high-dose version for people over the age of 65. And I understand that those companies that manufacture those vaccines have ramped up manufacture. They're sure they're going to have enough by the end of November, but I would recommend that you call ahead and make sure that whichever one you need or your family members need, according to their age, that those will be available when you go to get it. So who needs the flu vaccine? Well, I think I've already said everybody, nearly everybody needs to receive the vaccine, except for infants under the age of 6 months. But that especially younger kids between the age of 6 months and 59 months, and older people, people over the age of 50 years, are at highest risk for flu. Also, people with certain chronic health problems like cardiac disease, respiratory disease, HIV, AIDS virus, diabetes, and obesity are at higher risk. And so, although we try to get everybody to go in and get a vaccine, we also do try to focus on making absolutely certain that the highest risk people are getting them. Others that are very high priority for vaccine are healthcare personnel, caregivers, household contacts of young infants, children and people with high-risk medical conditions, pregnant women, as I said before, people with AIDS, but also others who are immunosuppressed for any reason, such as people who have received a transplant. However, again, infants under the age of 6 months should not receive the vaccine. And again, people with egg allergies need to talk to a healthcare provider because there are egg-free vaccines available and you don't want to have an allergic reaction to your flu vaccine. Anyone with a history of Guillain-Barré syndrome or GBS, I think you know it if you've had it. It's a very severe disease. It causes paralysis, but you need to talk to your medical provider because if that's too recent, then you wouldn't be qualified to take the vaccine. So turning to the topic of pandemic, though, so as I mentioned before, a pandemic is a global epidemic, and it happens when there is a newly emerged strain of flu, usually a new influenza A subtype. So we know that in the last year, which flu strains have been circulating across the planet and which ones we're expecting to come here. But a pandemic would be caused by one that hasn't already been circulating. And we've actually had four, the science says four pandemics in the last century, the worst of which killed 20 to 40 million people worldwide. And in fact, these are the four that we're aware of. The so-called Spanish flu, that was actually 100 years ago, 1918 through 19, killed 20 to 40 million people. The Asian flu that happened in the late 50s killed about 1 million people. The Hong Kong flu that wasn't even 10 years after the Asian flu killed another million. And then the H1N1 epidemic, and you can see actually there were 40 years in between the Hong Kong flu and the H1N1, which killed 200,000 people. And so I think you can see from this table that we really don't have a regular cycle of how frequently these pandemics come along. And it does appear to me that it's possible that we're doing better over time with reducing the numbers of deaths globally from these pandemics. So again, a pandemic is caused by a new flu virus, and this new virus is easily passing from person to person because basically no one has any immunity. They haven't been vaccinated. It's a novel virus. We don't have immunity from former years. And so it spreads very widely and it causes more serious illness. There are things about the world that have made pandemics scarier. We have a much larger population. We've changed over 2 centuries from less than 1 billion to 6 to 7 billion people. We have intercontinental travel that occurs over the space of hours rather than months. Millions of people are traveling rather than hundreds. We have crowding. We've improved our population health, but we've changed how we deal with animals. And some of these novel viruses come from our farm animals, our chickens, our pigs, and those viruses in those animals recombining with human ones. And our dependence on other countries has increased, and which means that we need to have more commerce across the world. So the opportunities for virus emergence and spread are definitely there through, modern production of pigs and poultry, the proximity of people to those, but just the crowding that we have and the amount of travel that we have that allows for virus spread. If I cough or sneeze and there's just one person in the room, there's less likely for spread than if there were 100 people in the room. So everyone is at risk if there's a pandemic, but some risks are at a greater risk of some groups at a greater risk of serious illness than others. Until a virus starts circulating, we don't really know for sure who is at most risk. For example, in a normal flu epidemic, it's the youngest and the oldest in the population who are at highest risk. But the H1N1 was particularly risky for young adults, adolescents and young adults. And that's something we couldn't have predicted before we were actually in the middle of the pandemic. So we have a lot of lessons from past pandemics. The unpredictability, not even always in winter. The H1N1 started in summer. A lot of variability in the mortality, how bad is the virus and how severe is the illness, and what is the pattern of the ages that are most severely affected. Rapid surge in the cases over brief periods of time and occurring in waves. But the key thing is that these tend to be unpredictable. So we can define different stages, and I think these are important. One, the first stage, and we've done a lot of work to be more effective with this stage, globally identifying and investigating cases of novel virus. Getting in there early makes a difference. Training health workers to recognize when a novel virus has a potential to be transmitted from one person to another, being able to see the initiation of the first pandemic wave, which will then accelerate, and then many people are infected and then decelerate as the wave goes down. And then we have to prepare for a future wave because some of these pandemics have second waves that can be worse than the first. So there is no vaccine that's waiting in a freezer somewhere to distribute if there's a pandemic, because you first have to identify the specific virus. You can't predict it ahead of time, and the ordinary flu vaccine or some past vaccine will not provide protection. So what can we do? One thing is that we try to interdict the transmission at the earliest possible time, find those first few cases, quarantine them, prevent that first wave from even happening. And if we start to see acceleration of transmission, then there might be actions that are very difficult for society to take, which we saw with H1N1. Many of you will remember that we were closing schools and daycare centers, trying to promote social distancing so we wouldn't be sneezing on each other and touching each other, decreasing unnecessary travel, and when needed, using antiviral drugs as prescribed, of course, by physicians. So my parting message, what do we do now? First and foremost, get the flu vaccine, unless you're one of the rare individuals that has an exception, a reason why you can't have the vaccine, or, of course, a young infant. But the second thing is to be prepared for flu. Understanding the symptoms is very important. And then if you recognize you may have the symptoms, to not go to work or school, and to try to avoid transmission to others, especially those who are at most risk. That's often our loved ones, family members who are young infants, family members who are elderly. You do not want to be the person who spread the flu to those individuals. So thanks so much for listening today, and I hope that you feel not only prepared for flu season, but to talk to others, patients, members of your community, about how to do that. Thank you.